In India, the prevalence of diabetes is just over 7%. In the US, though, the prevalence of diabetes in South Asian Americans is 27%. That's higher than the prevalence in African Americans, Chinese Americans, and Hispanics. Why are South Asians in America so predisposed to diabetes? Well, it's thought to be multifactorial. There are issues with insulin resistance, insulin secretion, visceral adiposity, so fat, also lifestyle factors, unhealthy diets, sedentary behaviors, and also some exposures passed in utero from mom to baby can be inherited and transgenerational. Let's talk about body composition in South Asians. So South Asians were actually found to have more visceral fat, so that's fat around our organs and in our muscles, and also lower lean body mass, so less muscle when compared with African Americans, Chinese Americans, and Hispanics. So, big question, is the South Asian diet healthy? Well, the thing with South Asian diets is they're highly variable. Diets high in processed carbohydrates, saturated fat, trans fats like our samosas and mithai, those are not the most healthy, but we do have some very healthy options like our vegetable sabjis and dal and those high fiber, lower glycemic index foods that can keep us healthy longer as long as we're cooking them without a lot of additional fat. Should South Asians eat meat? Well, studies have shown that South Asians who eat meat had higher BMI and higher waist to hip ratio. However, vegetarian diets high in fat, refined and processed carbohydrates, sweets, those types of things, were actually linked to more insulin resistance and lower HDL, which is the good cholesterol that we actually want to be high. So a plant-based diet has been shown to be healthful and to prevent diabetes, and a plant-based diet can actually be adopted with non-veg and veg options. Do South Asians exercise enough? Well, South Asians were found to be the least physically active ethnic group, exercising half as much as their white counterparts. So exercise can actually decrease the risk of prediabetes and diabetes. Does sleep matter for South Asians? Well, high rates of disordered sleep with sleep apnea were seen in South Asians, especially men, which can lead to higher blood sugars and blood pressures. Culture can actually affect diabetes prevalence in South Asian women. Women who prefer South Asian culture over US culture and women who prefer US culture over South Asian culture actually have increased diabetes prevalence than women who prefer both equally. Does religion affect diabetes risk in South Asians? Well, South Asians who identified as Hindu, Muslim, or Sikh actually had higher rates of overweight and obesity. The cause is unknown, but it's thought to be perhaps due to high refined carbohydrates and fats eaten at cultural gatherings. Low and normal weight in South Asians does not translate to health. People with normal BMI of less than 23, which is considered normal in South Asians, even though BMI is not my favorite, still can have high risk of cardiometabolic disease. That's like heart disease and diabetes.